If your child says they're seeing double, your first question is probably, should I be worried? And the honest answer is, it depends. Most of the time, double vision in kids is caused by something manageable like tired eyes, a focusing problem, or an uncorrected prescription. But occasionally, it can be a sign of something more urgent that needs immediate attention. So, how do you tell the difference? That's what I'm going to show you today. When adults say they're seeing double, they can actually describe it pretty clearly. Two images side by side or one on top of the other. But kids don't always have the words for it. They might say things like, the words are splitting, or I see two teachers, or the TV looks funny. Sometimes they just complain that their eyes feel tired or that reading gives them a headache. So, if your child is describing anything like this, or if you notice them squinting, closing one eye, or tilting their head when they're trying to focus, it's worth investigating. Now, the first thing we need to figure out is whether the double vision is happening with both eyes open or whether it's still there even when one eye is covered. The distinction matters a lot because it points us towards completely different causes. Here's a simple check you can do at home. It's not a diagnosis, but it helps you understand what's going on. Ask your child to look at something across the room like a picture on the wall, a clock, or anything with clear detail. Then have them cover one eye with their hand. Ask them, do you still see two or just one? Then switch, cover the other eye, and ask the same question. If they see double only when both eyes are open, but it goes away when either eye is covered, that's called binocular double vision. It means the two eyes aren't working properly. This is the more common type in kids. If they're still seeing double even with one eye covered, that's monocular double vision. In children, this is usually caused by something like astigmatism, where the shape of the cornea of the eye creates a slight ghosting effect. Both types are treatable, but they have different causes and different solutions. So, this simple check gives us a starting point. Now, let me walk you through the most common reason kids experience double vision. The most common cause of binocular double vision in kids is an eye alignment or eye teaming problem. You might have heard terms like strabismus or squint. This is when one eye doesn't point in the same direction as the other. Sometimes it's obvious, but you can see one eye turning in or out. Other times it's subtle and only happens when the child is tired. Here's what typically happens. Your child's eye might be aligned fine most of the time, but when they get fatigued, maybe after a long day at school or a lot of reading, one eye starts to drift. We call this decompensation. The eye muscles get tired and can't hold the alignment anymore. When this happens, the brain receives two different images that it can't merge together, and your child sees double. This type of double vision is often intermittent. It comes and goes. Your child might be fine in the morning and struggling by the afternoon, or they might only notice it when they're doing closed work like reading or homework. If you've ever noticed your child's eyes occasionally drifting, especially when they're tired, this could be what's going on. The good news is that this is very treatable. Depending on the severity, we might use glasses, vision therapy, or in some cases, a referral to an ophthalmologist. But the first step is getting a proper assessment so we know exactly what we're dealing with. The second most common cause is related to focusing and convergence. And this is one that's becoming more and more common with the amount of close work kids do these days. When your child looks at something up close, their eyes need to do two things. They need to focus the lens inside the eye to make the image clearer, and they need to converge, which means both eyes turn slightly inwards to point at the same spot. If either of these systems gets fatigued, double vision can result. I see this a lot in kids who do a lot of reading, homework, or screen time. Their eyes are working hard at close range for extended period, and eventually the muscles get tired. The eyes can't maintain that inward turn and the images starts to separate. These kids often describe the double vision as worse in the afternoon or after doing homework. It might not happen at all when they're looking at things far away. Sometimes this is related to being long-sighted. If your child has a plus prescription, their eyes have to work extra hard to focus, especially up close. The extra effort can exhaust the system faster, and this is very manageable. Glasses can reduce the strain, and vision therapy can help strengthen the coordination between the eyes. But we need to identify it first. Now, I need to talk about the causes that are less common but more serious, because this is where timing really matters. If your child's double vision came on suddenly, as in it just started yesterday or today and it's constant, not coming and going, that's a red flag. Sudden onset of double vision can occasionally be a sign of something neurological. In very rare cases, it can indicate a problem affecting the nerves that control eye movements. I want to be clear, this is rare in children, but it's serious enough that we don't take chances with it. If your child has sudden double vision, along with symptoms like a severe headache, vomiting, droopy eyelids, or any difficulty walking or coordinating movements, don't wait for an optometrist appointment. Go to the emergency department straight away. But if the double vision has been happening on and off for a few weeks or months, and there are no other concerning symptoms, it's much likely to be one of the alignment or focusing issues I mentioned earlier. Still worth getting checked, but not an emergency. So let's say you decided to book an appointment. What actually happens when you bring your child in? When I see a child with double vision, the first thing I do check is their prescription. We get them to read the letter chart and put lenses in front of their eyes to see if they're short-sighted, long-sighted, or have astigmatism. This alone can sometimes explain the double vision, especially if it's the monocular type caused by astigmatism. Next, I do what's called a cover test. This is where I cover one eye and then the other eye and watch how the eyes move. It tells me whether the eyes are aligned properly or if one is drifting. I also check how well the eyes work together at different distances, near and far, and assessing the focusing system. All of this is part of a routine child's eye test. It's not invasive, it doesn't hurt, and most kids handle it just fine. Based on what I find, the treatment path might include glasses. If there's an uncorrected prescription, especially long-sightedness or astigmatism, glasses can make a significant difference. Sometimes, that's all that's needed. Vision therapy. For kids with intermittent alignment issues or convergence problems, vision therapy can train the eyes to work together more effectively. This is usually done in the office with specialized equipment. Prisms. In some cases, we can add prisms to glasses. This shifts the image slightly so the eyes don't have to work as hard to align. It doesn't fix the underlying issue, but it can relieve symptoms. Referral. If the alignment problem is significant or if I suspect something neurological, I'll refer to an ophthalmologist for further investigation. The main thing I want you to take away is this. Don't assume your child is making it up or being dramatic. Kids don't usually complain about their vision unless something is genuinely bothering them. If they say they're seeing double, believe them and get it checked. If your child is experiencing double vision and you want to get to the bottom of it, the best next step is a comprehensive binocular vision assessment. If you're in Perth, you can book a consultation at the Myopia Care Clinic. We'll assess your child's eye alignment, focusing system, and prescription to figure out exactly what's causing the problem and what we can do about it. The link to book is in the description. And if you want to connect with other parents navigating their child's eye health, I've created a free community called Healthy Kids on School. It's a supportive space where you can ask questions and get guidance. That link is in the description as well. I'll see you in the next video. Bye-bye.